It's great to be here with all of you today. I'm really excited to be here with my co-presenters. We're going to be talking to you about really the very beginning phases and part of the process um, that is involved in a systems change initiative. So we are going to be talking to you today about this process of really getting a sense of your community and what your community's strengths and needs are as the foundation for really building a systems change program. My name is Bob Franks. I'm the president and CEO of the Judge Baker Children's Center in Boston and a faculty at Harvard Medical School. I'm going to be your lead presenter today. Hopefully we'll be sharing some interesting information with you along the way. My co-presenters, Jesse Watrous from University of Maryland and Sue Kearns from University of Denver are here with me today. They'll be chiming in at points throughout our presentation, as well as answering questions in the chat along the way. So if you do have questions as you're listening to the presentation today, please feel free to put them in chat. We actually have folks who are monitoring the chat, and also Sue and Jesse will be watching to see if there's some questions they can answer before we get to the Q&A at the end of our presentation. You know, it was really interesting to see the results of the poll you took when you came in. So I don't know if folks actually had an opportunity to do that. I'm just trying to, I don't know if we could put those up right now. There we go. So when you look at the folks who were able to answer our poll, I know some folks are still coming into the room. We can see that a lot of folks, over half, have already conducted a strength and needs assessment. And, you know, we're seeing that most folks in the group are either have no idea where to begin, or that you feel like you have some idea, but you lack a plan and are not sure where to start. That's 60% of the folks you know, that are in this presentation. We have some folks who feel like they already have a plan and have some level of confidence in getting started. When you think about where you are in the process, as we would expect, most folks are literally just beginning to generate ideas or pre-planning, or they're in the very early stages of development. And then also when you think about, do you already know the strengths and needs of your community? It sounds like most of you feel like you have some understanding, but you feel like you need to know more. So hopefully our discussion today will help you along with that process as we move forward. And we look forward to moving ahead with you. So let's see. Our goals today are we're going to give you a very brief overview of how this strengths and needs assessment process fits into the overall implementation of a systems change initiative, particularly when you're thinking about implementing new programs or services, evidence-based treatments within your system of care. We're going to be talking a bit about the process for conducting a strengths and needs assessment. We're going to have you do a little breakout activity where we can do some brainstorming, come back and give you some examples of the ways in which strengths and needs assessments have been used. And then we're going to do a little teaser at the end where we start to think about fit and how this information will be used in our next session, where we're really talking about EBP selection and program selection based upon the results of that initial assessment. And finally, we're just going to end with a little review of the use of a logic model, something that many of you may have used in your initiatives. We feel that it's very useful as a tool to really frame the broader process. So we'll be talking to you about that as well. So diving right in, you know, when you really think about the change process, all of us who are presenters on this call work broadly in, you know, the implementation and dissemination field, and have done a lot of work thinking about how we take ideas, best practices, best models in to the real world with good outcomes. And that that role of bridging that sort of gap between knowledge and practice is really the role of implementation science. And we hope that for all of you, as you're doing this work, that you really do think about embedding the work in an implementation framework, and that you really do think about this as a process that occurs over time, with multiple stages and using a variety of tools along the way. It is important to take a structured approach to change as we move forward. This is something that we're hoping that you could fit this piece of the work into a broader perspective of an implementation initiative. Most importantly, if you look at these NERN, the National Implementation Research Network, identified these basic stages of implementation. We're really in that very first stage of exploration when we're talking about conducting a community strengths and needs assessment, because we're really trying to figure out, we're really exploring, we're trying to figure out where do we begin. And really, when we're thinking about what we want to change, we first have to understand our community better. We have to understand strengths and needs. So this is the point, very beginning stages of the implementation process, and in some ways probably the most important, as we really get to understand what our community needs. So when we're going to be talking about today is really this process for how we move forward with conducting a strength and needs assessment. We're going to try to identify some salient issues. We're going to help hopefully generate some thinking and ideas with you. You won't leave here today necessarily knowing, okay, what do I do next and how do I do this? But we're hoping to identify those issues for you so that you could begin thinking about the process and work with your community partners to really begin a structured approach to conducting this basic assessment. We'd like you to start by doing a little activity. So I'd really like to get a sense, when you think about your community that you live in, what's the most important strength of your community? And if you could write one word, that would be really helpful. Okay. As folks are wrapping up with that word, do it really quickly. Stream of consciousness, can you pull up those results? So we're seeing words like inclusion and resiliency and empower, collaboration, a really important piece of, creating a strong community. Creativity. We could see more folks identifying, collaboration and being collaborative as key. Connection, support, knowledge. Really see collaboration resonating with a lot of folks. And this is actually going to be something that we'll dive further into, really thinking about how to leverage that existing collaboration in your community, thinking about identifying and strengthening those relationships and partnerships, and how we can use that as a basis for thinking about how to move forward. So we're going to move on to our next question. And this is really around the needs question, and we decided to really zero in on mental health needs. So think about your community and what's the most significant mental health need or challenge that your community is facing? There's some instructions in the chat if you're having problems using the word cloud. So we're seeing a lot of things that people identify as being lacking therapists, lacking resources, lacking services in the community. And these really are beginning to emerge as the wholes, the things that we really need to focus on. And it's interesting to see across all of your different communities the way in which some of these needs that you perceive as really having a lot of overlap and intersection. This idea of lack of support. And we're also seeing a really important theme here around racial stigma, racial equity, really making sure that not only are we addressing the needs, but we're really addressing the unique needs of our community and making sure that we're supporting others in our community. Making sure that we have linguistically competent services, culturally competent services, thinking about how we can best support families. So you can see that across the folks participating in this seminar, we're seeing a lot of needs and a lot of areas of concern. And one of the things I want you to start thinking about is, as you're thinking about a systems change initiative for your community, how do you build a program that really addresses some of these issues and concerns? So we're going to move on. Thank you so much. I think there are some really interesting results here. And I believe I need to reshare my screen. Okay. All right, so let's jump in. What is a strength and needs assessment? It's really a process that helps you determine what needs to be accomplished and how to reach your goals. And it also serves as a tool for decision-making, resource allocation, and reaching your program goals. So, we're really seeing this is not just sort of a activity that you do and walk away from, but it actually should be, in many ways, the foundation for what comes next. When you think about, your bounded system, whatever that may be, your county, your city, your town, your state, wherever you're thinking about doing this initiative, the strengths can be individuals, organizations, institutions, services, supports, resources, all those things. People talked about collaboration that happen in your community, whether they be, entities within your community, people in your community, or relationships among people in your community. And the needs are really the gap between what is and what ideally should be. And what's really important to note is that needs can be felt by individuals in your community, but they can also be felt more broadly by families, groups, or the entire community as a whole. I think one of the most important things to consider when you're beginning this process, and in order to really make sure that you're getting the results that you're looking for, is really to think about, number one, who's asking the questions and who's at the table. So sometimes when we're conducting a strength and needs assessment, it can be challenging if someone from outside the community is asking the questions, because there might be a level of trust in getting the information that we need. Sometimes when you're conducting needs assessments, it's helpful to do that in partnership if you're using a local university partner or an evaluator or an intermediary organization. It's helpful to have those linkages to the community, and really thinking about making sure that we have representation at the table of all the different people that would be involved in this initiative. So funders, government agencies, community members and families, provider organizations and other service organizations, your implementation team, your local implementation team is going to be doing this work, faith-based institutions and others. And for each community, it might look a little different, but really spending some time and asking yourself the question, do we have the right people at the table? The next thing that we really need to consider is, what are the questions that we want to ask, and how do we ask the right questions? One of the biggest things to consider is we can sometimes bias our responses by the questions that we ask. So if we go into a change initiative thinking to ourselves, what we really need are increased in-home support for families, and we ask questions that really support that outcome, we may see that that's where we land. which is not necessarily a bad thing, but we have to be aware that the questions that we ask and how we ask them can actually impact the answers that we get. So do we have predetermined goals and ideas? Are we supporting any form of implicit bias in the questions we ask? And how do we make sure that the questions that we're asking are inclusive and are identifying the true strengths and needs of the community? When we think about the community, we really have to think, about the local context, really thinking about, how do we identify the strategies to make sure those community voices are heard, and maybe people that wouldn't normally participate in a community assessment, how do we reach them? What avenues do we take? Perhaps using non-traditional methods, reaching out through faith-based institutions, community centers, using parent partners in the community, and then really thinking about what are the issues that people care about. So are we kind of standing on the outside, sort of saying, hey, I think this is what this community needs? Or are we really hearing from the community members that, hey, this is what we're struggling with. These are the issues that impact us on a day-to-day basis, and these are our priorities. So really thinking about, who those voices are. It's also really important to think about the source and quality of information. So what's the data? What's the quality of the data, and where are we getting it from? This idea about, as we're working on an initiative, we're going to talk more about fit later when we come to selecting interventions, but we also want to think about, are we trying to put a square peg in a round hole? Do we have an idea about what we want to do, and we're kind of trying to force that and make that seem right? Or are we really trying to think about letting that need in the community define the shape and nature of the initiative or intervention that we're trying to use? So this is a really important question about fit. So what are your objectives when you're conducting the assessment? Why are you conducting the assessment? Really important to ask yourself that question. What are you going to do with the findings? Are you going to actually use those findings in a meaningful way to advance the work that you're doing? Have you already predetermined where you want to land, or are you really open to using the information you gather to change your approach, adapt your approach, or try a different strategy that actually might better fit the needs that you've identified? There's lots of types of data that you could collect. And one of the first things, that we like to think about is, a lot of data already exists. So you don't necessarily need to reinvent the wheel. Looking at public health data, looking at existing data within the child welfare system, looking at data collected by community partners, looking at data that's collected by schools or parent groups. There's lots of data that you can mine. And then, one of the questions is, as I keep saying, what's the quality of that data and how useful is it? When you're collecting new data, you can collect quantitative data by, conducting surveys, getting new information, pulling in information from other sources and doing a meta-analysis. But you can also really enhance that data through qualitative strategies, such as doing interviews and focus groups, and really talking to the people in the community, doing a qualitative analysis to really find out what matters to them. And sometimes, as I think many of us know that work in this field, you get a lot more out of a focus group than sending out a survey. Surveys have their use and they can be very helpful, but it's sometimes very nice to round out that information with some conversations with key stakeholders. As I said earlier, these questions about what data is already out there, and then what data do you need? And sometimes the data that's out there will give you part of the picture. And from looking at that data, you can say, well, you know what, we really need to have more information, for example, on how the pandemic has impacted families. And that might be information, novel information that you're going to need to gather before you move forward. One of the big things, though, I do want to emphasize is the point I mentioned earlier about that it's not necessary to reinvent the wheel often. And it's really important to start with what data do we already have? What information do we already have? And then identifying what data do we need? And really working with your community partners to look at the existing data sources and say, okay, this gives us part of the picture, but what other questions do we need to ask in order to get a better understanding of what our community's needs are? Some best practices that have been identified when we're trying to develop a service array in a community are really to move through this process of first assessing what your community, the population needs are in your community. What are the folks that live in your community actually need? Prioritizing what those needs are. So, what are we saying are most important? And then moving through the process of saying, what services do we already have to meet those needs? What are the gaps? Prioritizing those gaps, and then moving to selection. And we're going to be moving through this process in this EBP webinar series. Today, we're really going to be talking about these first two bubbles of really beginning to think about how we identify what the needs are. I do really want to emphasize that we need to be critical when we're looking at existing data sources. I mentioned this earlier. What is the quality of the data? When was it collected? Was it inclusive? Was it representative of the people that actually live in the community? Are there issues, in terms of, how the data was collected or who collected the data? It's very important that when we're using information, we look at it critically to determine whether or not it's a good source for us to base our conclusions on. I think, given the time that we're in, any of you that are beginning to work on any type of, systems change initiative, whatever that might be, trying to meet the needs of families in your community, we have to look at the impact of the pandemic. And particularly right now during this time, there's actually been some very interesting preliminary research that's been conducted about the impact of the pandemic. Penn State did a really interesting, collected some data that we're going to be publishing shortly along with other folks around the country, really beginning to ask these questions about what impact has the pandemic had on families. Many of us in this field, probably many of you included, anticipate there's going to be a really unprecedented tsunami of need. We know, for example, things like child abuse and neglect was really underreported in the beginning stages of the pandemic. And as we're starting to come out of the pandemic, we're starting to see a much higher increase in the acuity of cases that many of our child welfare organizations see through their child abuse and neglect emergency lines. So our safety net has not been functioning. We have a whole tremendous new generation of kids with needs that we need to identify, and we need to really think about how we need to change our practices in order to meet that need. So I think now at this point in time, more than ever, it's incredibly critical that we conduct the appropriate assessment on the front end to really understand what the needs of our community are, particularly as they pertain to the pandemic. It's also really important that we're realistic. So, we have limitations based upon our resources and capacity. How do we leverage those in the most appropriate way? How can we utilize community partners to enhance our capacity? Really thinking about what we can do in using that collaboration that you all identified as a strength. And recognizing that there are some limitations about what we can and can't do, but really trying to make decisions that allow us to get the best information based upon the resources we have. And really thinking about who our partners can be. Perhaps there is a local university. Perhaps there is a university affiliated intermediary organization. Perhaps there are local community centers or government partners that could really help us do this work and work collaboratively. What are our target audiences? What are the data sources? How do we really get to the contextual and cultural factors? We're going to be talking about this more in a minute. You might need more than one strategy to collect the data. So you might do a survey, you might augment that with some focus groups, and you might use administrative data to kind of round out from various sources to get an idea to answer the questions that you might have. And then also think about, when you're trying to get information from your community, that they have competing priorities, and it may be difficult for them to take the time to engage in this needs assessment process. I think, it's really important as you're looking at the results of your needs assessment to both think small and big. And what do I mean by that? I think it's really important to, number one, look at the data, and that'll give you some discrete information about specific needs in your community. But it's also important to try and tie those needs together to think about broader themes that a change initiative might address. So you might be seeing issues that are related to higher rates of domestic violence or substance abuse in your community as a result of the pandemic. You might be seeing increases in acuity of children exposed to violence and trauma. That may inform that your change initiative really needs to take a trauma-informed approach, which can be inclusive of those discrete needs that you've identified. It's also important along the way for it to be an iterative process. How do we get feedback from folks as we're moving forward? How are we engaging our community members as equal partners at the table? I love the idea that any decision that impacts families should include families sitting at the table. And I think it's really important that we make sure that family voice is heard, and that the process is participatory, and that we're really co-creating and co-designing the initiative as we move forward. We're about to move into a breakout, and the big question that I want you all to really begin to think about is this question of our underrepresented voices in our community. And I think for most of you that are at the beginning stages of this process, some of you may have some existing data, you may have an idea about the type of initiative that you want to embark upon, but how are we being sure that those underrepresented voices are being heard? Are we giving vulnerable families the opportunity to really voice their concerns? Are we really listening? Are we taking their expressed concerns seriously? And are we willing to change our approach based upon what we are hearing from them? How are we using non-traditional approaches to hear those voices from the family? So with those questions in mind, my co-presenters and I and some University of Maryland staff are going to break us out for about 10 to 12 minutes. I encourage you in your breakout group, you're going to be answering these general questions. Are the needs of your underrepresented community members being heard? What strategies can we use to make sure their voices are heard? And can you give us some examples of ways that you can use this information to respond to their needs? So we'll go ahead and begin that breakout now. As always, whenever we have a breakout, it never seems long enough. We had some great conversation in our group. I'll just start, and then I'd love our co-leaders just to give us a sentence or two about some major themes. Some of the great ideas that we heard was really making the space for families, actually paying them for their time, and allowing them to have a space where they can participate, and then trying to use that information in a really meaningful way. We also talked a lot about how in-person really helps, having more face-to-face, whether it's through Zoom or in person, and that there can be some limitations to trying to collect that data through surveys. So, Sue, do you want to go next?
Sure. It'll be hard to synthesize everything in just a sentence or two, but our group started with really talking about how, especially right now, access has become really a huge challenge. People's phones getting cut off, difficulty with the internet. And so had a few different ideas come forward. One innovative idea that's happening in Texas right now is doing listening sessions across the state, and trying to specifically meet with underrepresented communities to hear their voice. And what was really neat about that is those listening sessions are going to then inform the next procurement cycle for funding. So hopefully this will be backed up with additional opportunities as things move forward. We also heard a story from New York about using peer support and family networks to do strategic outreach as well. I'm sure there's a lot more that was covered. Those were just kind of two things that were highlighted in our group that were ways that folks have found to overcome some of the access issues.
Sounds fantastic. What a lot of great examples. Raj, do you want to go next?
Yeah, sure. So our group, we definitely talked a lot about those barriers, such as transportation, not having those effective planning processes to get some of those underrepresented voices heard. Some of the things that help address that is looking at the communities that maybe that trust is already built, and asking them for input and needs, and helping that bridge, connecting communities to systems. someone in Kentucky mentioned that they're having youth forums where youth are leading some of these conversations around diversity, and people in the community are also, and systems are allowed to kind of jump in and just help have those kind of conversations. And one last thing, someone also mentioned having those family and peer support to help mentor and also like help families with some of those needs.
That's great. Thank you, Raj. And Jesse, you want to finish us out?
A lot of what's already been said, peer support, partnering with organizations that represent communities that you're looking to serve better, and utilizing specifically those community partnerships in any types of qualitative data collection. So if you have there was an example of the peer support organization partnering with another organization to do the focus groups to kind of represent that voice in the decision-making process. And then the other point that was made was that when you do bring families and youth to the table, do that early and continue in terms of keeping them at the table.
I love that last example, that example too, Jesse, of, and I think it's something we could all learn from, is that idea of really partnering with people in the community, from the community, as we're collecting that data. Sometimes when you come in as an outsider, there could be trust issues, and also really to make sure that those voices in the community are being heard. I think the other theme that sort of we hear in our group, and I'm hearing in yours as well, is this idea of being creative. I think, really using some non-traditional approaches. Someone in our group talked about working with an Amish population and working with the bishops to allow the use of technology for telehealth. What an incredible and powerful example of working with a cultural leader in a community and a faith-based leader in a community to try and address and meet the needs in a challenging situation. So this was great. We could actually spend the entire rest of the session, I think, talking about this. I really appreciate everyone's participation, and I think there's so much more to be said. I am going to go back to sharing my screen, and just bear with me for a moment. It always goes back to square one. Okay. So, what are some examples of how these needs assessments can look? I'm going to start, and then I'm going to turn it over to Jesse to talk about a few examples. The County of San Diego did a community strengths and needs assessment to develop a community action plan. And, when they did this plan, they really tried to identify and assess the needs and resources in the community. They'd use it to establish a really detailed plan with goals and priorities for delivering services to both individuals and families. And in order to get there, they first broadly said, what existing data do we have? So they collected data about their region, demographic data, information, including, age, gender, race, ethnicity, poverty levels, really trying to describe the community so they can better understand it. And then they also really tried to understand the specific needs in their community by really looking at partnering with local community members, community agencies, and then looking at the availability of resources like, youth programs and housing. Also looking at the prevalence of gang activity in their community, exposure to violence and trauma in the community, access to healthy food, infrastructure, employment, and transportation. So they took a pretty broad look, and then they distilled that information to really think about a community action plan to move their community forward. All right. I'm going to turn this over to Jessie. She's going to talk a little about another example.
Yeah, hi. So before I came to the university, I was with the Annie Casey Foundation for over a decade and worked on an adaptation of a model that actually provides an approach to needs assessment and implementation of evidence-based services. And that is communities that care. The adaptation that was developed is evidence to success. And I worked on the development of that with a bunch of other folks, smart folks, and implemented that with Providence Children's Youth Cabinet as an initial demonstration in 2011. And what we were able to do is adapt the CTC Youth Survey to develop what we called the Youth Experience Survey. And that assesses youth risk and protective factors across 5 domains. So antisocial behavior, social delinquent behavior, sexual behavior, problem sexual behavior, substance use, emotional well-being, and education. And this is an example of, there was some qualitative strategies, and this was the quantitative strategy. And what was good about it is it's a brief survey where youth themselves are reporting on their experience, like quite literally their experience of witnessing violence in their families, their neighborhoods, their schools, their peers, and the positive opportunities they have in school and with peers. So it's really them, in many ways, I believe, raising up their voice in this quantitative data. So next slide. So with this implementation in Providence, Rhode Island, this shows the data here. And what it did was assess across those 5 outcome domains, and within those domains, looking at individual youth risk and protective factors. And what was interesting about it really was the setup of the partnership itself. So it was about bringing together communities, and in this case, 3 neighborhoods in Providence, Rhode Island, which each worked together to have a community board. And then we brought together system stakeholders, the schools and child welfare and others, to do some strategic planning together using this data. And so identifying collectively where the priorities could be set based on the needs assessment data. Next slide. And so just one of the things that's really neat about the survey, is if you're going to try a survey approach, is trying to understand kind of what elevated indicators mean. So comparing across communities and to other cities nationally. Next slide. Pass it over to Bob.
Yeah, great. So we want to make sure you have a few minutes for questions at the end. So we're just going to go through quickly these last slides. There's never enough time, and I think some of the discussion, taking some extra time for discussion, was really important. I do want to just highlight that there are a variety of strategies that you can use when collecting information about your community. Geomapping is one. There's some really good information about how geomapping can be used, and sometimes that information can be displayed visually, so we can really get a sense of things like what are the abuse and neglect rates, or out-of-home placements, or exposure to trauma in a community. And we can actually map those and see where the needs are in a community. Some examples of that were the California Child Welfare Indicators Project, the New Jersey Child Welfare Data Map, and the San Antonio Metropolitan Health District. So those are things that if you're interested, you could kind of Google those, get more information on them. We could also share some more information, but they're good examples of the way in which this geomapping strategy has worked. There's also been a variety of frameworks that have been developed, that can really collect this information in a comprehensive way. So lots of examples out there. I encourage you, if you're in the beginning stages, to really look for those partners in your community that have some experience doing strengths and needs assessments, to look to other examples of what communities have already done. I'm always a big fan of not reinventing the wheel, and using some of those strategies as a basis for your own approach in your own community. And I'm going to turn it over to Sue to talk about some challenges and barriers.
Thank you. Of course, all of the components of assessing community strengths and needs that Bob and Jesse were talking about come with challenges and barriers that are critical to consider when you're developing your plan. So having knowledge and awareness of these barriers can really help you get a leg up in your planning process. Of course, some challenges and barriers can be predicted and planned for. Sometimes challenges and barriers surprise us as we move through our system change initiatives as well. But of course, it's important to at least be able to have a plan around those that you can predict. Here we provide some examples of common challenges and barriers that we've encountered in work that supports initiatives within the child welfare system. So you may observe some of these challenges are more malleable than others. For example, we can't really do anything. This came up in our breakout group as well. You can't really do anything about the historical context, right? That you're trying to do your change initiative in. But knowing where the historical pain points have been can be incredibly valuable in helping you to move forward in a smooth way in your implementation efforts. And, the same would go for knowledge of any bureaucratic challenges that you might have. We know those tend to kind of muck up or slow down processes. And so the extent to which you can build in your knowledge of that in your timelines and in your approaches can be really important. Other challenges and barriers you might be able to address directly through strategic action. So I'll just provide one example in the interest of time. If you anticipate that buy-in could present a challenge, you might consider nurturing credible messengers for the new initiative, or be sure to include thought leaders on your implementation team as you're going through your needs and strengths and needs assessment. I'll just end there because I know we're a little tight on time, and turn it back over to you, Bob.
Thank you, Sue.
Mm-hmm.
Great. We're actually, I think what we're going to do is, Jesse, we're going to skip the logic model overview. I do just want to emphasize that, okay, so, gave you a lot to think about today, wanting to make sure those underrepresented voices are heard, wanting to really use the existing data in your community, using novel data collection approaches to really get at what's important to your community, and then what do you do with it? Well, that's really going to be the theme of our next session. So we want you to start thinking about, this session is really getting you to think about making sure you're asking those right questions, making sure you have the right people at the table, thinking about how to strategize about how you're going to use that information to inform the next stage. But we do want to really emphasize that there's not one size that fits all, and we have to really think about fit as we move forward. And ideally, we hadn't decided on our approach and our initiative before we collected this baseline data. Hopefully it can help inform what we're doing. Just one really quick example. If you look at sort of the boxes on the top half of this, we might have done our needs assessment and found that we really needed trauma-focused care and treatment, that there were high risk factors for things like community violence or neglect. We might find that there are some capacity issues around financing or community-based resources. And we also may find that there are some barriers around data sharing as examples. And so, then we kind of think about, all right, how do we begin to build our program? How do we begin to make those selections, thinking about what are the best available treatments we might have to address trauma-focused needs, TFCBT for school-age children, PCIT, which has been widely used for the NCTSN and other initiatives to treat trauma in younger children and children with behavior problems, and then thinking about those modifications. So are there things like we need to translate our interventions to make them culturally competent? So we're going to get much deeper into these issues. It's a little teaser for next time, but we really want you to think about this issue of fit, and really considering beginning, once you have identified those needs, what are some practices out there? What is their availability? What is their applicability? Do you have the capacity for training and implementation? Are they culturally and linguistically appropriate? Are they aligned with your culture? And can you deliver these in an ongoing way? So we will end there. I will just say, in terms of our logic model, we just put in a couple slides. We're going to go over it broadly. Hopefully most of you have used logic models. We just want to offer that as a recommendation, that it's a really helpful way to ground what you're doing. And really, when you're thinking about these early stages of what are your inputs or community-based resources, it really can help you think about what activities and outputs you want to move towards in your logic model that are based upon that front-end needs assessment. So really glad to have this time with you. We're going to actually move to having a little Q&A in our last few minutes. I know we've been monitoring the chat. Are there any questions, Raj, or others that really have risen to the top for our panel?
The only question that was unanswered was, will there be a more depth training for strengths and need assessments? So I'm not sure if the next training will include that.
So our next training we'll be talking about how we can use the outcomes of the needs assessment. I think that if you have specific questions regarding conducting the needs assessment in your community, this was really meant to be like the general introduction, and we encourage you to identify those community partners. You could reach out to any of us if you need some help in thinking about what those next steps are. If you're really at that very beginning phase from our poll, those folks that kind of said, I'm not sure where to begin, can certainly help you think through that more. But looking for some local resources, community partners, sometimes universities in your area, or large behavioral health organizations, or even government agencies that can partner in these initiatives. I don't know, Sue or Jesse, if you have other things to add.
Well, I was going to say, Maryland, for anybody here from Maryland, the Institute's been working with Department of Human Services to do sort of a needs assessment with the local Department of Social Services in service to filling gaps under Family First. And so we have had a couple webinars where we could do a little bit more concrete nuts and bolts. And so I can, possibly we can find a way to share that maybe when this goes out. Or if not, just feel free to reach out to me, and I'm happy to share some of those webinars.
And we could send that information in a follow-up to folks who participated today. I do just want to let you know our next workshop is going to be around selection of evidence-based programs to find one that fits, taking the results of that needs assessment and thinking about what do I do with it. That's really what we're going to be focusing on. The link will be in the chat, and that also the Center of Excellence on LGBTQ and Behavioral Health Equity, along in partnership with my organization, the Judge Baker Children's Center, are going to be doing affirm training and purveyor-led coaching for agencies providing behavioral health services to youth. So I encourage you to learn more about those. The links are in the chat. There's never enough time for these discussions. We're sorry we couldn't go deeper and have more conversation. Hopefully this whet your appetite. We're here as resources for you, and we'll be getting deeper into this process in our future webinars. Finally, the Institute's Focus program also is providing some evidence-informed care coordination practice. And if you'd like to learn more about that program, there's also a link in the chat, and we'll be sending this out to you after the webinar today. I believe that there should have been an exit survey. Hope that you can all take that. We look forward to seeing you in future webinars, and good luck with this process moving forward.